We're looking now at a side picture of the pelvis, and here is the tailbone or the sacrum, here is the pubic bone, and what you have to imagine is that you have the edge of the pelvis going away from us, so we're looking at half a bowl. The inner muscles of the pelvis, the deep intrinsic muscles of the pelvis, are called the levator ani, and what they do is that they cover the inside of this bowl. So they create almost like a basket, and they're there to hold your insides from falling out, which is quite important. They're made up of a series of slings, and the slings start in the front. They start at the pubic bone, and they move around each organ, going from the front, forming a sling and coming back. And the first is the ureter, which comes out of the bladder. So you have a bladder here, and there's this little sling that goes around the ureter. In women, that sling is utterly vital. It actually will help with continence because they have a very short urethra. If you cough, then you may leak. With men, usually the problem as you get older is just the opposite, because at the base of the bladder is the prostate. So this muscular sling slips around the back of the prostate, and it may be quite closely involved with the prostate. This is very important because inflammation or pain arising from the prostate, so-called chronic prostatitis, often will also involve the muscles of these pelvic slings. Then in women, the next layer, next big sling, will go around the back of the vagina, and then both in men and women, the next one will go around the rectum. And again, the sling that goes around the rectum will help with the bowel continence, which is a very important function in all human beings. We'll now look at a picture from below, which will give you another view of these slings, and it just makes it easier to see. And we're now looking from below. So this is someone lying on their back with their legs going outwards, and you're looking at what's called the perineum, which is the area between your legs. And what you can see is at the back, the gluteus maximus, which is that fold of muscle, the big bottom muscle. And now here's the anus. So this is a picture of a female, and so here's vagina, and there's the little urethra opening, and there's clitoris. So remember, the slings of muscle arise from the pubic bone, and they run backwards like this and hook around. You can't quite see, but there's a sling that comes around the urethra, which is the outlet of the bladder. Then there's a sling that runs around the back of the vagina, which is called the bulbocavernosus, and it actually, everything joins in here to a central body, which is called the perineal body, and this is a fibrous band, fibrous ball that sits here, so everything joins into that. And then the next layers are what are called the levator ani, and these are slings that come right around and join. And as you remember, if you're looking at it, there's a bowl where you're looking at the bottom of the bowl, and the bowl is going away from you up into the picture, which is holding all these muscles. In men, this is where the prostate is. So what we'll look at now is the pain that arises in these muscles. Trigger points occur commonly here, and then in here and there. Now each one of these, the one in the front, will affect function of passing urine. So you may have difficulty initiating because everything is tight. In men, you may have difficulty actually passing urine. So there's you'll stand, and it's a symptom almost of prostatism, where the prostate gland gets large and blocks the urinary outflow. The next layer, which is the bulbocavernosus, if there are triggers here, that may give pain with intercourse, and the last may give difficulty when you try and pass a bowel motion. You may feel localized pain and have some difficulty in emptying your bowel. So they can give symptoms that occur with the use of the particular organ, that they form a sling running around. Also, you may get pain, just pain itself, and the pain is normally diffuse. You can't really put a finger on it, literally can't put a finger on it. It's deep inside your pelvis. In men who have chronic prostatitis, they feel pain which is here, and the pain is deep inside, and it runs along the base of the penis. It may run out into the testicles, and it's just deep inside the pelvis. And men who have this describe it, it's a deep, constant, niggling away pain that absolutely drives them to despair. It is often associated with depression, and there's no doubt that this creates a vicious cycle, so that if you have the pain, it will make you feel depressed. If you become depressed or anxious, that will increase the pain. In women, this kind of pain is often diagnosed as chronic pelvic pain. It's a more common diagnosis in women. Again, the majority of doctors are going to look at the organ, so they're going to say, do you have problems with your vagina? Do you have problems with your cervix? Do you have problems with your uterus, your tubes, your ovaries? And often diagnoses will be made around these organs. A very common diagnosis that is made is endometriosis, and there is no doubt that there are what are called pathological changes, so that if you have someone looking into your tummy and will see areas of endometriosis scattered around, except that quite often endometriosis pain is quite odd. In other words, you may have women with widespread evidence of endometriosis with very little pain, or you may have women with just a few little patches of endometriosis who have a lot of pain. And associated with this pain, it's not uncommon to have trigger points in this area of the pelvic muscles. Pain arising in the levator ani will often refer to the tailbone. So you have coccyx pain, and the common name is coxodynia, which is pain in the coccyx. And what will happen here is that when you sit down, especially if you slouch and lean backwards, you get a sharp pain in this area. And the other characteristic is that if you have been sitting for a while and go to stand up, you get an even more sharp pain in this area, and the pain may radiate out on either side. This is a common pain. It can occur after a blow to the tailbone, but it may just occur out of the blue for no reason. And often treatment just of the coccyx isn't enough, and somebody needs to look for trigger points in this area, in the levator ani. I'm not going to be able to show you examination of these points because they're deep inside the pelvis, and the only way to access these trigger points is either to do a rectal examination or to do a vaginal examination. Both of these give access to the pelvis itself. And the person, normally doctors, this is an examination that's done very often by doctors, but what they're doing as they do a rectal examination, normally they're trained to check for cancer inside the rectum, or they're trained to feel across to look for an appendix that's sitting, the appendicitis that's here. If the doctor does a vaginal examination, they're trained to check what the inside of the vagina feels like, and then to check what's the size of the uterus, are the ovaries enlarged, is there tenderness where the tube is, and they're not trained to check for these muscles. You need to have somebody who has this knowledge, and they then, if you're checking, you feel the coccyx from inside, and then you run your finger across in a stripping action, like that, across, feeling for the trigger points, and as you come to the trigger point, it's a really sharp, intense pain just there. And at that point, the person doing the examination can just reduce the pressure, just as we've done with all other triggers right throughout the body, reduce the pressure until there's no pain, gradually increase the pressure. So you need to sit there over, a minute or so, gradually increasing the pressure until it melts away, and then you stretch the muscle by doing this stripping action, moving across the pelvis and like that. So this is a really rather uncomfortable examination, but it can be literally transforming. It can switch triggers off and they may not come back. The same can be done through a vaginal examination, where again you can feel to the back and feel around the wall of the pelvis. So not focusing on the organs, which are slightly higher up in the pelvis, but down onto the wall of the pelvis. And here, often if the bulbocavernosus muscle is in spasm, which will cause pain with intercourse, you feel it like a ridge in the vagina. And again, the action is to find the trigger, switch it off, and then do that stripping motion of gradually moving around, pressing and stripping right through to stretch the muscle. And this you can actually train your woman patient to do to herself, or she can ask her partner to do it. And you find these areas, switch them off and stretch them, and the triggers go. And lastly, in men, this big problem of chronic prostatitis. And again, the prostate can be felt through a rectal examination. And normally this is very commonly done by doctors. You feel into the rectum and you find the prostate gland, which you can feel as a swelling. It's a walnut-shaped gland. And often the gland itself, if there's chronic prostatitis, will be exquisitely tender. And there has been a treatment which is called a prostatic massage. And what happens there is that the doctor will start at the top of the gland and strip downwards to force out any little pockets of infection or inflammation in the gland itself. And this is often incredibly sore, will reproduce the patient's pain. In other words, you'll feel it deep in your pelvis and you'll feel this pain running right up into the penis. And once you've finished the prostatic massage, often you can get quite significant pain relief. If you added to that prostatic massage a massage of, and in the same way switching off the bulbocavernosus and any other Levator ANI trigger points that are found, and you did the same treatment that we've discussed before, often there will be a significant improvement in the pain of chronic prostatitis. So this is something that's really important, and unfortunately is actually not recognized by many urologists who treat this very distressing problem.